Hi, welcome to the Hi9 viewers. I am Dr.Ranga Reddy Sirigiri, pediatric ENT surgeon at Ozone Hospital, Kottapet. Today we will be discussing about the snoring problem in children. So, snoring is not only common in the elderly population, we are commonly seeing even in children group these days. So, we should not neglect a child who is snoring, because snoring doesn't mean a sound sleep. Snoring means it's a disturbed sleep. The child is not getting the sufficient sleep. So, whenever we see any child having the snoring during sleep and mouth breathing and also excessive salivation from the mouth and muffled speech, we should suspect some obstruction at the level of the oropharynx. So, this obstruction is because of in children mostly because of the tonsil and adenoid hypertrophy. So, these tonsils and adenoids are the lymphoid tissues which protect us from the infections from bacteria from outside. So, this is one layer of our immunity in the oral cavity, but this does not mean even if we remove this we will not lose the immunity, because there are other layers of the lymphoid tissue that come rescue for the immunity. When do we suspect this problem? So, whenever we see child with this sleep problem like snoring during sleep, mouth breathing and excessive daytime sleep and laziness during daytime, and when they are lagging behind in the school, so we should suspect there is some sleep problem in the child. So, whenever we see the child, we should bring to the ENT surgeon and then we will check the oral cavity. So, we will see is adenoids. So, these adenoids are the tissue on the back of the nose. So, when they are big, the nose will be blocked from the back side. So, they cannot take the breath from the nose. So, they have to open the mouth to breathe. So, that is why they open their mouth during sleep, and also they keep they snore a lot during the sleep. And this excessive salivation also because of the mouth breathing all the time. And the tonsils are, as you know, because these tonsils are the lymphoid tissues in the oral cavity on either side of the tongue in the mouth. So, these are also, whenever also they are big, they also cause the breathing problem. So, whenever we suspect this problem, so we should start with some medical management, like we will give some nasal spray. So, thinking that it might decrease the swelling, the edema of the adenoids and the tonsils. So, if the swelling is not that bad, so this spray would be enough to control the symptoms, but if the adenoids and tonsils are so big, this spray does not help. So, then we have to go for the surgery. We may have to remove the adenoids and also tonsils depending on the size of the adenoids and tonsils. So, it is not a big surgery, and we can do it lasers like coblation these days without losing much of blood. Even in the small child like 2 years also we can do this surgery. So, the risk with the surgery is always the blood loss. So, this will be reduced with the coblation. So, this coblation is a new technique which is like a kind of a laser, but it works in the saline medium. So, there will not be much temperatures, and it does not cause the thermal damage to the adjacent tissues. So, this tonsillectomy and adenoidectomy is a simple surgery done under general anesthesia, and we do with the coblation, and we will send on the next day itself. So, it is not a risky operation, we can do safely, and the complications are again the bleeding. So, the common complication is the bleeding. So, whenever you see bleeding after the surgery, it is very rare though, like 1 to 2%. So, whenever you see the bleeding, you should come back to the hospital and we can treat that complication also. So, my final message is whenever you see a child snoring and mouth breathing and also getting some recurrent throat infections, you should suspect some tonsil and adenoid hypertrophy, and that is causing the obstructive sleep apnea in children. So, you should try with the medical management first, and if it fails, you should not worry about going to the surgery, that is the tonsillectomy and adenoidectomy, which is done with the new techniques like coblation without much complications. Thank you.